Good morning to everybody, and welcome to our podcast. I'm Dr. Gregory Crichlow from AvantBlue, the center of the universe, and we're going to be calling our podcast series the Blue View. So we have Dr. Janiece here.
Hello.
All right, the real Dr. J. We have Myra.
Hello.
Myra is one of our key persons that you will be interacting with. All right, so we're not going to do necessary J plasma on the face, right? Renuvion. We're not doing scary surface. But we can do PDO threads, right? Yeah. Right, so we're talking about skin tightening because, of course, there's tons of things you can do for the face, but we're specifically talking about PDO threads. All right, so tell me, what is a PDO thread?
Okay, so PDO thread is a type of surgical suture which is used in order to help with the laxity of the skin.
Right.
So when I place the PDO threads, they go underneath the skin. They can sometimes be smooth or they can be barbed, meaning that they have little spikes on them, which can grab the skin and help keep...
Every time you say spikes, I'm taking...
No. But as I said, they're surgical sutures, so they're very flexible. So it's not something like it's a metal spike going into the skin. So it goes under the skin in order so that it can pretty much grab the skin and pull the skin to keep it in place. Right, and that really helps with, as you get older, you get more elasticity to the skin and the skin starts to droop. Right. So it helps pull the skin backwards to...
So, because I'm always doing this in the mirror, right?
Yeah.
I would do this sometimes, say, you know what, if I were just...
So usually once your patient always is in the mirror, saying, I just need this, then you're definitely a great candidate for PDO threads.
Right.
And another thing that really is good for PDO threads is that they increase the collagen formation in the area that we place the threads as well. And as you get older, that's what causes elasticity of the skin because you begin to lose that collagen, right? So once you place that, your body begins to create the collagen again, then helping with the elasticity of the skin.
Okay, so let me get this up by way. So it's tightening the skin. Like you said, right? So that means the threads are dissolved.
Right, so after about 4 to 6 months, the threads do dissolve. Right, but
building collagen, so it's stimulating collagen formation.
Exactly.
Well, so that's really the long-term effects of it. Okay. When can we do? I need some. I need all these procedures already done.
As soon as we finish here, I can start your doc.
All right. So the face definitely I can see how that's like a no-brainer for the face, and I can see it for the neck. Anywhere else in the body?
So you can even add it to the abdomen. You can do it on the abdomen as well. It also helps patients again with the skin laxity. There are persons who after pregnancy have some laxity to the skin. We can also tighten the skin as well with the PDO threads. You can also have a butt lift as well with the PDO threads.
Right. So now I know we talked about the Renuvion J plasma, and I know for sure you need some sort of sedation for that. Because if you're going to be heating the skin, it's pretty uncomfortable. What about the threads? Do you always need sedation?
No. The threads can be an in-office procedure.
Right.
I can apply some topical lidocaine or numbing agent to the skin, and you'll be comfortable throughout the procedure.
And how tight can you make these threads? I mean, like, if it won't be like tight.
I make them as tight as possible.
Good. Okay. And what should I expect after the threads? Any tools?
So after the threads, my major complications or side effects would be you would get swelling and you would get bruising. And you can get some soreness and pain to the area as well. But nothing that paracetamol or Panadol can't fix.
Right, yeah. And I would really call that a side effect or complication. That's just a normal result of the procedure. All right, well, that's good. Excellent. Have either of you ladies tried the threads? Of course, I know if Dr. Spray has had the threads before.
I had the threads to my chin.
Right, yeah. That's why she looks so youthful. You can't tell she's headed towards 60, She's had all these aesthetic procedures. All right, great. So we talked about Renuvion J plasma. We talked about threads. What else is a hot button for the patients? Am I right? Unless you think.
The non-surgical BBL.
Non-surgical BBLs?
Yeah, because they have like our slim girls who may not have enough fat
Right.
to transfer, but now they can do our non-surgical BBL. And you don't have to go into the OR. It's just like the PDO tries. You can come have it done in the office, go back home like normal. And they love that.
They've enjoyed the results.
Yes, the results, like when Dr. Springer did it and she showed me, I was like, what? That's amazing. And I think what they liked about it is that they could have gone right back into work. Nobody's in their business. You know, privacy is a big thing I find for our clients, which I respect. So you can come get that done, get your little top up where it's needed, and just go on with your day.
Great. So we covered a number of things today. We covered the Renuvion J plasma, which seems to be a hotspot. All right. We covered PDO threads, which is acted as well for facial rejuvenation, because I think that can carry the facial rejuvenation client a lot further than just the typical run-of-the-mill Botox and fillers and things like that.
And some persons want a cat eye as well.
The cat eyes.
So the cat eye you can get at.
Or fox eyes. Is that for guys? I'm trying to get a list of things that I need to do.
What a guy should consider is your J plasma, get those ab etching in.
The abs.
Yes.
So me up. And of course we talk about non-surgical butt lifts and so on. With that section, I think that one of the fundamentals though that I want to talk about in terms of facial rejuvenation, I want to get back a little bit to the PDO threads because we're trying to touch a number of areas. So I think that one of the plastic surgery aesthetic considerations is volume and lifting. So you have volume deficits, which means you lose volume with time, whether it's in the butt, whether it's in the face, you lose volume, or whether it's in the breasts after pregnancy, you lose volume, but then you also get skin laxity, which means that the skin becomes loose and it sags. So we're addressing volume and we're addressing laxity or looseness. For example, let's say a lady becomes pregnant and the breasts, they're lovely, they're right over there, you know, and then the baby just sucks everything out of it. Particularly, you can always, you know, I can tell when a lady comes into the office, I can tell exactly which breast she was breastfeeding from. Because that one is the one that's, you know, suffering, right?
Screaming for help.
Yeah, from these little precious these little precious parasites, right? That suck everything out of the ladies, so can change their body so much. So then what happens is that they lose volume, but then the breasts also become looser. So sometimes you may take a lady post-pregnancy, you may do a mastopexy augmentation where you're lifting and adding volume. So I know in facial aesthetics, it's pretty much the same concept. And, you know, when we do facial plastic surgery, we're lifting, which we do rhytidectomies, aka face lifts, eye lifts, brow lifts, and things like neck lifts. And you can even do lip lifts and, you know, upper eyelid lift, lower eyelid lift. And of course, you can do rhinoplasty. So a rhytidectomy is like a facelift where you are treating the wrinkles with laxity. But then we also add volume. And we add volume through dermal fillers, like sculpture, like hyaluronic acid, and for example, and we also use nano fat. And then we're also lifting. So we're lifting, we're adding volume. So I see the threads really coming into that assistance right there and giving the patient a non-surgical lift. Because if you're just getting Botox and you're just getting fillers, that can only take you so far. And you can really address a lot of, if you're correct in placing the volume and you're also correct in placing the Botox and you're very skilled at it, you can definitely, you know, mimic lifts. So sometimes you hear people talk about a liquid facelift. It's a term that I might use and things like that, where you're using liquids to produce a facelift. But if you're combining this with now an actual lift with the PDO threads, which then is building your collagen also, so the lift stays more longer lasting. I can see that as a really powerful combination where you can do the PDO threads, but you can also do the Botox fillers, the skin resurfacing such as microneedling, PRP, and everything else that you do. And that's really good. So we need to drill down into that a little bit more.